In Nigeria, non-communicable diseases account for 1 out of every 4 deaths. Also, 1 out of every 5 deaths between ages 30 to 70 years, which we call premature mortality, were due to non-communicable diseases.
Non-communicable diseases, mainly cardiovascular diseases, cancers, chronic respiratory diseases, and diabetes are the world's biggest killers.
More than 41 million people die annually from these NCDs, accounting for 71% of global deaths.
Every time when the thing start, I think say na malaria. We start with urine. I will go urine frequently.
Many people are also becoming more sedentary. They don't move around as much as they used to move, as our fathers and our grandfathers did, trekking or walking to the farms, riding bicycles to the farm, living more actively. Because of this, cardiovascular disease is really, really on the increase.
It's a BP issue that just kind of stroke. I couldn't recognize objects or people.
I was admitted when she gave birth to me. I needed to be transfused.
The earliest sign that of sickle cell disease occurs in babies when they have painful swelling of the hands and feet of the infant.
We also have sickle cell disease, mental, neurological, and substance use disorders, road traffic injuries, and violence also contribute significantly to these numbers.
I could remember what happened to me at the scene of the crash when I discovered that I couldn't stand on the legs.
A number of lives that are lost from various non-communicable diseases can be quite distressful.
Often misconstrued as a problem of high-income countries only, the NCDs place an equal, if not greater, burden on low and middle-income countries.
After I started my chemotherapy, within a space of 3 months, I exhausted all my savings, and I had to call my siblings.
And it reduces people into tips them into poverty.
Sickle cell has affected me a lot. For school, I've not been able to go to school.
And the lifestyle changes that has happened to me, the pains I experience on a daily basis, even right now as I'm speaking right now, I'm feeling the pain. If this pain persists, I still have to visit the hospital again.
All of these admissions and coming for treatment, it's paid out of pocket by the parents.
They share 4 main risk factors, which are tobacco use, harmful use of alcohol, physical inactivity, and unhealthy diet.
NCDs create an adverse economic effect on families and communities.
And not more than 5% of Nigerians or so are on National Health Insurance Scheme. So these human beings suffering from this expensive disease, they are on their own.
Because sometimes it's the financial implication that makes patients to decide to go for alternative medicine. That is the truth.
I'm not going to tell you a lie. The thing, it collapsed my business. Nothing there for my shop again. Even though people, they help me to buy food for my children.
Everything actually went down. The whole business I had, they went down.
NCDs threaten progress towards the 2030 Agenda for Sustainable Development, which includes a target of reducing premature death from NCDs by 1/3 by 2030.
Nigeria is struggling to achieve the WHO Global Action Plan for NCD.
To lessen the impact of NCDs on individuals and society, a comprehensive approach is needed, requiring all sectors to collaborate.
In view of this, the NCDs Multi-Sectoral Action Plan 2018 to 2023 was developed with a wide range of stakeholders drawn from multiple sectors to address NCDs.
Multi-sectoral actions for the prevention and control of NCDs is the systematic, cross-sectoral engagement of all levels of government and industry to address the health dimension of their activities.
The plan focuses on 8 major NCDs, which contribute substantially to morbidity and mortality of NCDs in our country.
Tackling NCDs and their risk factors require a response from sectors beyond health. Strategies and approaches exist that can deliver shared gains for all sectors involved. Multi-sectoral action for the prevention and control of NCDs is the systematic cross-sectoral engagement of all levels of government and industry to address the health dimension of their activities.
The civil society continues to collaborate with the Nigerian government in multi-sectoral action and policy implementation steps.
Early detection, screening, and treatment of NCDs, as well as palliative care, are key components of the response to NCDs.
Fulfilling the pledges and first of all, committing is a good way to start, and then fulfilling such commitment is the next step.
When implemented, it will contribute to 1/3 reduction in premature mortality by 2030 in alignment with SDG 3.4.
The result of such action include implementation of health in all policies, whole of government and whole of society approaches for addressing NCDs.
It also establishes a framework for reducing morbidity and mortality from NCDs within the context of the broader Nigerian health system.
From the global best practices, it's been found that multi-sectoral approach involving the various stakeholders coming from different ministries, departments and agencies, organized private sectors, non-governmental organizations and the civil society, working together brings the best results.
So I think if all these things are there, Nigerians will be better for it. And it's going to help a lot of indigent citizens who can't even afford it.
I urge us all to join hands together to beat NCDs in Nigeria.